Are you up all night urinating? Has your stream slowed down? Are you going more often or having to rush to the bathroom? Then this podcast is for you. Welcome back to the Rena Malik MD podcast, your source for evidence-based medical and sexual health content. I'm Dr. Rena Malik, urologist and pelvic surgeon. Today, we're diving deep into a condition that affects millions of men worldwide, benign prostatic hyperplasia, or BPH. We'll cover what it is, why it happens, how you might be able to prevent it, the truth about supplements, and the various treatment options that are available to you to help manage these symptoms. So let's start off. What is BPH? Well, BPH, or benign prostatic hyperplasia, is an enlargement of the prostate. Now, the prostate is a walnut-sized gland located just below the bladder surrounding the urethra. And that's the tube that carries urine out of the body, or I like to call the P tube. Now, BPH occurs when this gland gets bigger. Now, you may not know this, but it is incredibly common. By the age of 60, about 70% of men have BPH. Let me say that again. By the time you're 60, 7 out of 10 men will suffer from BPH. And by the time you're 80, that number jumps to 80%. But having an enlarged prostate doesn't always mean that you're going to have symptoms. And the size of the enlargement doesn't always correlate. Sometimes you'll get an exam by your doctor and they'll say, well, your prostate's not that big, but your symptoms are really bothersome. And so it's more than just the size. But very often it's because there is some degree of an enlargement. Now, what sort of symptoms are there? When you do have symptoms, they're typically related to urination. So here are the things you might see. Increased urinary frequency, going to the bathroom more often, more than 8 times a day. Urinary urgency, this sudden and strong desire to urinate that you can't delay. Nocturia, waking up more than one time at night to urinate. More than one time is considered abnormal. A weak stream, having sort of a less strong, forceful stream compared to what it was like when you were maybe in your 20s. Hesitancy, which is essentially a difficulty starting urination, and intermittency, this stopping and starting of your urinary stream. You may also feel what we call incomplete emptying, or feeling like you can't really fully empty your bladder. And sometimes this is also correlated with post-void dribbling, meaning you urinate and you think you're done, and then right afterwards you get a little bit of dribble afterwards. And sometimes you can have leakage, and usually this is leakage because you gotta go, and can't make it to the bathroom. Or sometimes you get leakage because your bladder gets so full that you have what we call overflow incontinence. And so you're leaking because your bladder is just too full and it can't hold any more urine. These symptoms can affect people variably, meaning that some people are really not bothered, but for others, these are really significantly impacting their quality of life, particularly in those patients who wake up at night to urinate. Not only are they at risk for falling on their way to the bathroom, which is very concerning, particularly in older patients, because once you fall and you go to the hospital because of that fall, over the next year, your risk of dying goes up to 20%. These falls are really serious. So that's really a big issue for me. And then secondly, you're not getting good sleep. You're waking up all the time. You're tired. You can't fall back asleep. And this can really affect your quality of life. Now, the other important thing to realize is that BPH is not cancer. Having a large prostate does not mean that you have cancer, and it doesn't increase your risk of prostate cancer. So now, why does BPH occur? Let's get into the science. Benign prostatic hyperplasia is a complex process, and it can involve issues with hormones, genetics, and inflammation. Hormones do play a significant role, particularly in the prostate. So we know that the formation of the prostate, or the size of the prostate, is sensitive to what we call DHT, and this is a byproduct or conversion product of testosterone. So we know that some men who have a large prostate will have higher levels of of DHT, but that's not everybody. And we know that it's not just due to testosterone, because if it was just due to testosterone, then we know that testosterone decreases with age, so people's prostate wouldn't continue to increase. So this is where these other factors come into play. Inflammation is a big one. So chronic low-grade inflammation in the prostate can promote growth. And this inflammation can be caused by a variety of different things. This can include things like infections. So you may have bacterial or viral prostatitis or infections. You can have some hormonal changes which are inflammatory, or even autoimmune changes. And also changes in the prostate microbiome. Interestingly, when you have inflammation, it triggers the release of certain growth factors like the epidermal growth factor or the insulin-like growth factor and transforming growth factor beta. These then send signals and stimulate cell growth and division, which then cause what we call cell proliferation and cause an enlargement of the prostate. Now, when you think about BPH or any organ, really, there's a balance between cells growing and cells dying. And so there's always new cells being created, for example, in our skin, and cells being sloughed off. In BPH, there's an imbalance. More cells are growing than dying off, and this leads to enlargement. The other thing that happens is as the prostate grows, it creates areas where there's low levels of oxygen. Now, these areas of hypoxia trigger, again, more inflammatory substances. So we're getting this vicious cycle of growth, inflammation, low oxygen, creating more inflammation, creating more growth factors, and then you continue to get enlargement. Now, another factor is genetics. So there's a hereditary component to BPH. If you have a close male relative, usually a father, who's had BPH at a young age, meaning before 60 years of age, you may be at higher risk. In fact, we find that people who do have a genetic component are more likely to get BPH symptoms as early as their 40s compared to those who don't have a genetic component. Are you sick of going to the doctor only to have them talk at you for 15 minutes and leave without knowing exactly why they're prescribing you this certain medication and what exactly the next step is to take to optimize your health? Wouldn't it be great to finally find a doctor who actually listens to you, answers your questions, and doesn't rush you out the door? Well, at my practice, Rena Malik, MD, I aim to do just that. I specialize in taking care of patients who have issues with their sex lives, issues with their bladder, with their hormone health, or are having pain in their pelvic region or with sex. My goal is to give you the time and attention you deserve so you can leave with a clear understanding of your condition as well as our treatment plan that's optimized for your goals. During your visit, I'm 100% present with you for an entire hour. And after you leave, you can reach me. It is super easy to send me a message through our secure portal, and I'll get back to you within 24 to 48 hours. No questions asked, no hidden fees. Scheduling is easy. Just visit our website, renamalikmd.com/appointments. We see patients in both Irvine and Beverly Hills, California, and I see patients virtually in California, Florida, Illinois, Maryland, New York, New Jersey, and Virginia. Oh, and don't forget Texas. If you're outside these states, consider seeing me for an educational visit. I look forward to seeing you. Another risk factor is what we call metabolic syndrome. So this is where conditions like diabetes, high blood pressure, obesity, link to the higher likelihood of having BPH. In fact, having diabetes more than doubles your risk of BPH. Another factor is the sympathetic nervous system. So when you have increased activity of the sympathetic nervous system, this can cause an increase in smooth muscle tone of the prostate, which can contribute to symptoms. So anything that's sort of revving up your sympathetic nervous system, that fight or flight system, may make these symptoms worse. Now that we know sort of what factors go into creating an enlarged prostate, we can talk about prevention. So we can't control every risk factor, right? We can't really control genetics. We can't really control aging, but there are things that we can do to reduce our risk that are evidence-based. First and foremost, maintain a healthy weight. Studies have shown that men with a BMI over 35 have more than double the risk of developing BPH compared to men with a BMI under 25. And a waist circumference, if you have a waist circumference of over 40 inches, this increases the risk by about 50%. So maintaining a healthy body weight and reducing body fat is very important for reducing all this inflammation that then begins that cascade. The next thing, number 2, is stay active. Regular physical activity is very helpful. Even light exercise has been shown to reduce the BPH risk by 30%. Now, what's light exercise? That's 2 hours of walking a week. That's less than 20 minutes a day. So really, even 20 minutes of walking a day can help reduce your risk. Now, if you exercise regularly, about 6 times a week, they've shown that these men have a 50% lower risk of BPH. Next is diet. So diet does play a significant role. You want to limit high-fat red meats. So daily red meat consumption, and again, these studies don't control for the kind of red meat you're eating, but presumably really high-fat red meats increases your BPH risk by about 30% compared to eating it less than once a week. Eat more vegetables in your diet. So 4 or more servings of vegetables a day has been shown to reduce risk by about 30%. The other thing you may consider adding is lycopene-rich foods. So tomatoes, especially cooked tomatoes, contain lycopene. And lycopene has been studied and has been shown to help potentially prevent BPH. Watermelon's another thing that has a lot of lycopene in it. So what they found in studies is that high fat intake, which is more than 38% of your total energy intake through calories, increases BPH risk by 31%. And lastly, you want to manage your chronic conditions because these all increase inflammation. So keeping conditions like diabetes, high blood pressure, high cholesterol, keeping them under control is not only good for obviously overall health, for your heart, it's also good for your prostate. And lastly, be mindful of medications. This is one you probably haven't heard of before. Some over-the-counter medications can actually worsen your BPH symptoms. And one of these very commonly is antihistamines. These can relax the bladder, making it harder to empty. Another one is decongestants like pseudoephedrine or Sudafed. These can actually tighten the smooth muscles, making urination much more difficult. Some antidepressants also, particularly those called tricyclic antidepressants, can negatively affect bladder function. Now, it's important if you're on antihistamines for allergies or you need some of these medications, talk to your doctor if you find that you're experiencing urinary symptoms and say, is there something I can use instead? Quick break from this episode to let you know I am so grateful that you're spending part of your day with me. I started creating content online to empower people to learn more about their bodies without needing to go see a doctor, pay a copay, wait in a waiting room, or find parking. And it has been one of the most rewarding experiences of my life. If you want to help support our mission of providing free education, please consider joining our premium membership. There you will have access to ad-free episodes, which are released early, as well as free transcripts and the opportunity to ask me anything. And these questions are answered in our monthly AMA episodes. Support the show and join today at renamalik.supercast.com. Can't wait to see you there. Now let's move on to supplements. Everyone always wants to know, what can I take over the counter to help improve my symptoms? I'm going to start with the most studied supplement for BPH, and that's called saw palmetto. Early studies were really promising, but more recent high-quality trials have been done and have not shown significant benefits in comparison to placebo. So in one large study where they had over 3,000 men, they found that saw palmetto showed really no difference in comparison to placebo in terms of improving urinary symptoms, even at high doses. Now remember, placebo is just a sugar pill or something that you take that you think is going to improve your symptoms, but doesn't. I still find that some patients do benefit from trying saw palmetto. So I will suggest if you're going to try one, it may be one that you want to consider. However, we do have, again, very strong, high quality studies about saw palmetto that don't show a benefit in large patient populations. Next is beta-sitosterol. Now, this has less data. Some studies have shown some improvements in urinary symptoms and flow rates, meaning that your flow is faster, but it's missing a lot of long-term data. Next one is Pygium africanum. Now, this also has a Cochrane review. So a Cochrane review is essentially a very high quality meta-analysis that's done in systematic review of all the data. And they did that for saw palmetto, and they also did it for Pygium. And it found that there was some evidence of symptom improvement, but unfortunately the studies were all short-term and of varying quality. Pumpkin seed extract is another interesting one. Again, some studies have shown some modest benefits in symptom scores, but the results are not consistent. So sometimes you see a benefit and sometimes you don't. Stinging nettle is actually not really oftentimes studied by itself, but it's usually combined with saw palmetto. And in those studies where it's been combined with saw palmetto, they have seen some improvement in symptoms over a long period of time, 96 weeks. And lastly, lycopene. So I mentioned dietary lycopene, like tomatoes and watermelon, has shown benefit. Supplement data on lycopene is less robust. So I'd rather you eat your lycopene than take a supplement. Now, I think it's really important to remember that supplements can really vary in quality quite significantly. To give you an example, one study looked at 27 saw palmetto products. And what they found is that there was huge variability in the amount of active ingredient content. And so only 17 of those 27 met criteria for a proper saw palmetto supplement. So 10 of them didn't. And you always have to remember that natural doesn't always mean safe or effective. I like to say Botox is natural. You can find it in the environment, but large doses of Botox will kill you. And so you want to be thoughtful before you take a supplement, because we don't always know. There's very little regulation on supplements. We don't always know what's on the bottle is actually in the bottle. Make sure if you're taking supplements, mention them to your doctor before starting them, and also review the ingredients. Sometimes you may not realize that you're taking a whole bunch of supplements and you're taking more than you think of each individual ingredient. So before you even start taking a supplement, I would argue that behavioral changes can be just as effective, if not more. So one is, I always tell people to look at how much they're drinking. If you are drinking enough fluid, your urine should be about a light yellow lemonade color. If you're drinking too little, it's going to be darker than that. And if you're drinking a lot, it's going to be clear like water. Now, clear like water once in a while is not a big deal, but if it's always clear like that, you are definitely over drinking. So you want to make sure you're drinking enough. Some people think, oh, I should drink less, then my urinary symptoms will be less. But in fact, if you drink too little, your urine will get very concentrated. And if it gets very concentrated, it starts irritating the bladder lining, which gives you even worse symptoms. Next thing I generally recommend is looking at what you're putting in your body. So if you're drinking or eating things that can irritate the bladder lining, it may be useful to try taking them out of your diet for just a couple days. Now, this is not like a GI problem where you have to do an elimination diet and take something out for several weeks. Even a couple days will allow you to see a difference. So the one big offender is caffeine. And caffeine is not just coffee and tea, although those are the most common ones. And I will tell you, I see patients who drink so much caffeine. I mean, they drink like 6 cups of coffee a day. Of course, your bladder is going to be irritated if you're drinking that much caffeine. But caffeine can also be in chocolate, it can be in ice cream, it can be in a whole host of other things that you may not even realize you're taking in. Those Celsius drinks, those other sparkling waters, a lot of them have caffeine. So that's one. Another one is alcohol. Certainly we know that people will urinate more when they drink alcohol because it's a diuretic, but also it can irritate the bladder lining. So if you're having a glass of wine at dinner every night, that may be contributing to how much you wake up at night. Other things that can irritate the bladder are citrusy fruits and juices, sometimes tomato-based products. So lycopene, while we say it's great, sometimes it can irritate the bladder lining. So you sort of have to be thoughtful about that. Other things could be spicy foods for some people, artificial sweeteners, and even carbonated beverages. I've made a whole video on bladder irritants on my YouTube channel, so check that one out if you want to review a little more detail about these. The other thing is specifically at dinner. What are you drinking at dinner if you're waking up at night a lot? That would be where I would start. Versus if your symptoms are more during the day, then I would look at what you're drinking throughout the day. Also, how much are you drinking before bedtime? If you're drinking a lot before bedtime, like within the last 2 hours before bed, you're definitely going to wake up more. So I'll tell patients to try to limit how much they're drinking before bed so that they can see if there's a difference. The next thing is constipation. A lot of people don't realize that constipation will actually make their bladder symptoms worse, because when you're constipated, the stool is filling up the rectum, which is right behind the bladder, and it pushes against the bladder, making it more sensitive and making its symptoms much, much worse. So making sure you're not constipated is very helpful. I've made some content on my YouTube channel about a bowel recipe that I often use. You can also try Miralax over the counter, or natural regimens like prunes can be very helpful in reducing constipation. And as we've already mentioned, weight loss can be helpful. In fact, reducing even 8% of your body weight can significantly improve your urinary symptoms. And lastly, if you are smoking, quit smoking. Smoking is a huge bladder irritant. So please consider stopping smoking for not just your prostate, but for your bladder, for your lungs, for all the areas of your body that are being affected by the chemicals in smoking. Now, if you've tried conservative management, if you've tried to prevent enlargement, if you've tried a supplement, what can you do next? Let's talk about medical treatment. So in this podcast, I'm not going to cover surgical treatments because there are so many new treatments, and I want to make sure I give that topic the time it deserves. So I'm going to do a whole episode on surgical treatment of BPH. If you're interested in learning about a specific surgical option, make sure you comment in the YouTube comments or leave a comment on Spotify where I can see it and make sure that I cover all the different types of surgical interventions. So the most common medical treatment is called alpha blockers. These are often known as tamsulosin or brand name Flomax or alfuzosin. These work by relaxing the prostate and bladder neck muscles. This then makes urination easier because the urine can flow better across those relaxed, smooth muscles. Now, these work quite well. It usually takes about a month to see full effect, but very often they can work even sooner than that. Sometimes they do have some side effects. The one that I always caution my patients about is retrograde ejaculation. Now, tamsulosin, which is the most commonly prescribed one, has a very high rate of retrograde ejaculation. And what that means is that when you ejaculate, you will have a lower volume or no volume because it will be going back into the bladder rather than going out towards the opening. Fortunately, we do have other options like alfuzosin, which has a lower risk of retrograde ejaculation. And so that is a risk. The other one is that some people can get dizzy when they stand up too quickly. So they stand up quickly and they get a little dizzy and then they have to sit back down. Also, if you have to have surgery on your eyes, it can cause what we call floppy iris syndrome. So if you're about to have any surgery on your eyes, make sure to tell your urologist they don't prescribe this because otherwise it can make that surgery much more difficult for the ophthalmologist. Are you feeling in a rut in the bedroom, wishing you had the kind of sex life you could brag about? I've spent years helping patients and creating content for people all around the world to improve and optimize their sex life. Today, you can get my knowledge for 100% free with my new ebook called Better Sex, Better Life. In this ebook, I review my top 10 tips for improving your sex life, all from the comfort of your own home. All you have to do is go to renamalikmd.com/morepleasure to download it for free today. The next type of medication is called a 5-alpha reductase inhibitor. These are medications called finasteride or dutasteride. And how they work is they block the conversion of testosterone to DHT. And remember, the prostate is very sensitive to DHT. And then this works by shrinking the prostate. These can take a long time to work. Sometimes it can go as early as 3 months. Sometimes it can take as long as 9 months to see a benefit. These medications in lower doses are also used for hair loss, so that may be a nice side effect. However, there's two other major side effects that I want you to know about. One is that a small subset of people have sexual side effects that are very bothersome in terms of affecting libido, and that can be very serious because it can take a long time to go away. And I've talked about these in more detail on a YouTube video about finasteride and tamsulosin, so I'll link that here. The other side effect to know about is that it doesn't cause prostate cancer. However, if you're taking these medications, they reduce your PSA, which is a screening test for prostate cancer, by half. And what we found in the data is that when you're taking these medications, if you get prostate cancer, you are more likely to have a higher grade prostate cancer than if you weren't taking the medication. Now, it doesn't mean, again, that it causes prostate cancer, but there is this risk. And I suspect that part of it is due to the fact that it's having your PSA. And so when you look at that number in your mind, in your doctor's mind, it should be doubled for screening purposes. Now, the last medication that many people don't actually talk about is phosphodiesterase 5 inhibitors. And these are essentially tadalafil, which is the medication we use for erections. But at low doses, it works by relaxing, again, the smooth muscle to help with prostatic symptoms. It's actually a great medication, particularly if you're having both erectile dysfunction and BPH, because you take one medication and it will help with both. Side effects can be sort of having head cold symptoms, stuffiness or congestion, or muscle aches. But usually at the low dose, I find that most people do pretty well. Now, you can use combination. You can take both alpha blockers and 5-alpha reductase inhibitors, most commonly Flomax and finasteride, and they've shown in very good solid trials that this is even better for large prostates and those who have more severe symptoms. And so talk to your doctor. Make sure you're maximizing your medical therapy if you want to avoid having surgery, because we can do higher doses of the medication or take more than one medication at a time to see if we can improve your symptoms without needing surgery. Now, the good news is we now have so many options for BPH, whether they're procedures or surgeries, that can help you achieve symptom relief. So if you're sick of taking medications or you don't want to take medications, it's a great option to consider. And be on the lookout. If you like this podcast, make sure to subscribe or follow my podcast on whatever podcast platform you're using, or subscribe to my YouTube channel, because I will be doing a deep dive into all the surgical options. I'll be reviewing the data and telling you exactly what to expect after each of these options. And I may even have some guests on who are world experts in some of these newer options, that we can talk about what you can expect from the mouth of someone who's done hundreds, if not thousands, of these operations. Okay, guys, thank you so much for joining me on today's episode of the Rena Malik MD podcast. If you found this episode helpful, do me a solid favor. Tag this podcast, take a screenshot, and share it on your social media with your friends and colleagues, because I think everyone needs access to high quality educational content that is completely 100% free. That's why I do this, and I want more and more people to have access to it so that they can then be empowered to make the accurate evidence-based decisions for their bodies. And as always, remember to take care of yourself, because you're worth it.